Good afternoon, everyone. Today, my clinical discussion. My topic is polycystic kidney disease. You know polycystic kidney disease? Anybody know? Poly means many, and cystic means cyst of kidney and disease. This is a genetic disorder. Okay. Poly means many, cyst means cyst, kidney. It is a irreversible disease. Many cysts are present in fluid filled in fluid and water is filled in insect and many cysts is presented in kidneys. It's known as polycystic kidney disease. It's a genetic disorder. Parents if have any these types of disease, and then it goes to a child also. There are two types of polycystic kidney disease. One kidney disease is a type of polykidney disease in autosomal dominated of polycystic kidney disease is 50% and 90 cases of in adult. It is also known as adult PKD. And autosomal recessive kidney disease is also known as infetal PKD. Autosomal recessive polycystic kidney disease is present in pregnancy time in human. In child is in human is types of undevelopment of body in child in pregnancy time, and lungs is also undeveloped. That's known as a recessive of kidney disease. There are subtypes of PKD. One is PKD is polycystinic protein 2 and polycystinic protein 2. It is made in polycystinic kidney disease is more severe and early onset, and polycystinic 2 is mild and later onset. Symptom is there flank pain in after cyst is ruptured. Is flank pain, hematuria, blood in urine, and hypertension. Compress of tubal venous is called of hypertension. And kidney stone is also present, a progressive kidney disease. And diagnosis is USS and parental USS and CT scan, MRI, and genetic test of gene in children, and blood test, urine test, blood test in bone, keratin, urine test of polyuria, hematuria. Renal cystic disease is inherited and non-inherited. Inherited in largest of kidney with cyst in medulla. Medulla is inner side and cortex is outer side. And cyst is presented in medulla inner side and it's called medulla cyst, and present in cortex in outer side is present in cortex cyst. And Suken means spongy types of kidney with cyst in medulla. And multicystic dysplastic disease is development of both kidneys is undeveloped in children. In polycystic kidney diseases, autosomal two types of autosomal recessive kidney disease and autosomal dominant kidney PKD. And now we started polycystic kidney disease. Polycystic kidney disease is the inherited disorder characterized of development of multi-cyst of developed within kidney and causing of kidney enlargement and loss of function of over time, and prevent effective in 1 in 400 to 1000, and 1 to 3 needed of renal transplant and 50 of in stage of renal failure. Now after is damage of kidney is many cyst is presented in kidney. It look like this. Size is also bigger than in normal kidneys, and so damage of kidney is not working of kidneys, and it's cause of renal failure. Some patient is diagnosis also two of dialysis and transferred of renal kidney. Pathophysiology, genetic disorder of kidney with fill of 100 of cyst, more than 100 of cyst is presented in polycystic kidney and become of large unable function. It is the loss of function of kidney. It's not work properly. It's not urine pass of outside in properly. And cyst in outer layer, I already discussed, its cortex layer and inner layer in medulla in kidney. And cyst line of renal tubular of epithelium become large. And cyst is make of kidney large and over time and compress of blood vessel. And nephron, healthy nephron is also like compressed, and it is not blood is flow and urine flow outside, and it is compressed and activated RAS, RAS, and also it become hypertension. And sometime of patient of hypertension patient is come, and then also doctor is consult, you check your creatine and burn why sometimes creatine is high and burn is high. This is also causes of hypertension, and this is also a large cyst and compress of collecting system and urinary setting and kidney or stone is also because our urine is not pass out and collecting is so compressed, and urine not pass out, and stone is become here in collecting tubal. And classify I already discussed in another slide. And classification: autosomal dominated polycystic kidney disease and autosomal recessive kidney disease. In adult, this autosomal is autosomal means total 46 chromosome here, and autosomal chromosome is 22 and 1 sex chromosome, and this one is autosomal dominated polycystic kidney disease, and it's called of adult. In 30 to 50 years adult is so many cases of autosomal dominated polycystic kidney disease. Of chromosome, one chromosome, parents one chromosome is present in children is called autosomal dominated polycystic kidney, and two set of gene is present in two pair of gene is present in one mother and one father present in parents is called recessive autosomal recessive polycystic kidney disease. I already saw here. Here Autosomal dominated polycystic kidney disease affecting father and unaffecting mother. Both are crossing and the one is unaffected children. Both are coming same is unaffected children, and one effective and one ineffective is come effective children, and one is unaffected and effective is come of effective unaffected children. If 50% is case is come in AD PKD, and here both are different. Mother and father are unaffected, and both are cross, and then one children is called come in unaffected children, and both are carrier. If both the different is of coming, and is are both come up carrier is 50% and 25% of effective in children. Diagnosis is USS and parental of UCS and CT scan and MRI and genetic test of gene of children and blood test of bone and keratin and urine analysis of polyuria and hematuria. I already told of PKD1 mutation is one chromosome of 60 to 85% of more severe and early onset in PKD1 mutation, and PKD2 mutation is one chromosome of 50% of less severe and later onset. Polycystic 1 and polycystic 2. Polycystic means polycystic is made of one protein, polycystic protein 1 and polycystic protein 2. This one proximal tubule of renal tubules, and some cyst is presented here in tubules, and so nephron of tubules is compressed, and urine is not go inside of collecting duct, and urine is stored in collecting duct and it become stone, and sometimes it's compressed, and some patient is become of stone in kidney. There are nucleus and primary cilia. Cilia is also presented inside. It is cilia is presented like here type inside of tubules, and primary cilia is also called up. Fluid is not go out inside, and it is already storage here in tubules, and urine not pass out, and sometime of ADR. Autosomal recessive and PKD is infant patient is become of urine is not outbound in pregnancy type, and patient is become of undevelopment of fetal liver, and fetal is not working on nicely, and it is called autosomal recessive and PKD. Clinical manifestation of autosomal dominant in hematuria, and usually it is visible of throat to be due to the rupture of cyst into the collective system, and abdominal pain like flank pain is side pain occurring, including a polynephritic stone and hemorrhaging into the cyst. And second one, hypertension is greater than 50% of the case due to the compress of cyst and neighboring tubules, decreases the blood flow, decreases the oxygen, and activation of RAS system. And fourth one is palpable kidney on abdominal examination. Complication: intracerebral berry of aneurysm in 5% to 20% of case. Most do not rupture. If rupture, and subarytenoid of hemorrhage of circle of Willis. And second one, infection of renal cyst, bleeding into cyst, renal failure, late in of disease, and kidney stone, and cyst, another of cyst in other organ like liver, spleen, pancreas, and brain, and seminal vesicle. Cyst is also presented in other organ also. And diabetical is colon, hernia, abdominal, and inguinal. Heart valve of abnormality, specifically a mitral of valve and prolapse, and aortic route of dilation in heart failure. Diagnosis is ultrasound and multiple cyst and appear on the kidney, and sometimes ultrasound in stomach and CT scan and MRI. Autosomal recessive PKD is called of infantility of cystic kidney disease, becomes symptom of many facts of infantility, inherited mutation of both copy of gene, and this means of both parent must be carry of abnormal gene, and the both must of passes of the gene to the children in order for the child to develop the disease. It is the less common for the less common from the PKD compared to ADPKD. Gene mutation of PKHD mutation on chromosome 6, and fibrocystin in co-localized with a polycystin modulated of renal tubular formation, and by the regulating of polycystin A and expression of and function. Future of autosomal recessive disease with several ARKPKD, possible of renal failure before birth and decrease of urine production, low amniotic fluid, and oligohydration. Amniotic fluid of uterus, one fluid is there. After the fluid is less production of amniotic fluid, and babies become so polyhydramnios like this type. And pulmonary hypoplasia means our lungs of baby is not working and breathness is less, and sometimes babies become dead. And twisted of face, twisted of a plaque of nose also, and twist of skin, renal failure of uterus, and extremely defect of club feet is like this type of it. Liver involvement is always presented and may be to be dominant of clinical feature, especially in other individual hepatic complication of including and congenital hepatic fibrosis, and portal hypertension can be lead and compress blood flow of portal renal system. Sometimes it's called of esophageal varices and upper GIT bleeding, and splenomegaly and hemorrhoids and cholangitis. Pulmonary insufficiency of secondary to pulmonary or hypoplasia and enlarged of kidney, limiting of diaphragmatic movement may be several, and pulmonary complications are leading to causes of morbidity and mortality in the neonatal period. And kidney are also increases in size, which may be causes of several abdominal distension and hypertension. Main causes are hypertension and hematuria, and plankton is the main symptom in PKD. It look like a shape of kidney is so large, it's not working. Is some cyst is many cyst is presented in kidney. Treatment in hypertension, angiotensin converting enzyme inhibitor, captopril, ramipril, and angiotensin receptor of blocker losartan and telmisartan. And sometimes renal failure is dialysis and transparent, and portal hypertension and protoconvulsion and biopsy liver is transparent. antihypertensive ECG inhibitor, and tolvaptan is uses of it is the decreases of cyst growth in kidney. Antibiotic is used in the UTI and dialysis and kidney transference. One case is there, 54-year-old man come to the physician due to the blood in urine and abdominal discomfort and occurs 2 days ago, and he was moving a potted plant around his pouch when the start having pain in his abdomen, and afterward he noticed a blood in his urine, and but say resolved in the following day, and he was history of hypertension, and the patient it does not use of tobacco and alcohol and drugs, and physician is examination of showing no abnormality, and CT scan of the abdominal with contrast of so below. Here concept is there, and it is abdominal. Now it's polycystic kidney disease diagnosis. Thank you. Any question?